We are here in Bern with Professor Nicolai El Hindy. We are currently validating our models for the front and side. We would like to talk to him about his experience. Nicolai, thank you for the opportunity.
You're welcome.
And thank you for giving us the opportunity to test and validate our models with you. First question, what impression did the simulator?
I was very impressed. In fact, I work a lot in a lateral position, and that's what impressed me the most, because it almost looks real.
Thank you. What do you think? How can it help these types of simulators to training for these accesses?
I think that when you learn new approaches, there is always a necessary learning curve, and the options are not many. You can try it directly with the patient, which is not always the best idea, or you can try it in courses with real cadavers, which does not always correspond to reality, especially in retroperitoneal interventions. And I think it is an advantage to have models that are as realistic as possible to try this type of procedure. That's one advantage. And the other advantage is that you can try it directly in your own environment.
You mentioned something important, that surgeons don't need to travel to receive training.
That's right, we can take the training to the hospital and train them with our own equipment. We've just tried it, and it was very exciting for us. Also with the new technology, with the robots.
How can these models help people learn this new technology or integrate it into a hospital?
It is one thing to develop new technology and quite another to implement it in your daily work. When you manage to incorporate a model and adapt the technology around it, when you manage to train the whole team, from assistants to surgeons and nurses, that's when the process becomes truly exciting and rewarding.
If you could make a wish, how would you improve this technology, these simulators, and perhaps make training a little easier? What do you think?
It's difficult to say, because the problem is always who finances something like this. It would be ideal to have these models available in the clinic. It's also good that they are modular. On the other hand, it is essential to make it known that these technologies are available.
Thank you.